Good afternoon, everyone. Thank you for joining us for our webinar this afternoon on one of my favorite topics, Empowering Prosperity, Integrating Financial Capability and Asset Building Strategies into Human Services. My name is Michael Rausch, and I am the Director of the Real Economic Impact Network at the National Disability Institute. Before we get started with our webinar, I would like to give a special thank you to our sponsor, Bank of America, who for the past 10 years has been supporting the National Disability Institute and working with us to make a real economic impact for persons with disabilities. Before we get started on our presentation, I would like to turn it over to my colleague, Ashley Bray, who will be going over some housekeeping tips for us. Ashley?
The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. If you accidentally close the panel, you can reopen by going to the Communicate menu at the top of the screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer or prefer to listen by phone, dial toll-free 1-855-244-8681. The meeting code is 661-722-497. And just to note, you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you do not see the captions, you may need to open the Media Viewer panel by selecting the Media Viewer button in the upper right corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like the chat, Q&A, and/or participants. Submitting questions. For Q&A, please use the chat box or Q&A box to send any questions you have during the webinar to Michael Rausch or Ashley Bray, and we will direct the questions accordingly during the Q&A portion. If you are listening by phone and not logged into the webinar, you may also ask questions by emailing questions to mrausch@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the National Disability Institute's website at www.realeconomicimpact.org. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host, Ashley Bray, or you may also email abray@ndi-inc.org. The mission of National Disability Institute is to drive social impact to build a better economic future for people with disabilities and their families. NDI's Real Economic Impact Network is an alliance of organizations and individuals dedicated to advancing the economic impact of people with disabilities. It consists of more than 4,500 members located throughout the United States. It includes nonprofits, community tax coalitions, asset development organizations, financial education initiatives, cooperatives and private sector businesses, federal, state, local government and agencies, and individuals and families with disabilities. All partners join forces to embrace and promote and pursue access to and inclusion of people with disabilities in the economic mainstream. Learn more about the REI network at www.realeconomic-impact.org/rei-network.aspx. And with that, I will turn it back over to Michael.
Great. Thank you so much, Ashley. So again, thank you all so much for joining us this afternoon. We are excited to have our friends from the Institute on Assets and Social Policy at Brandeis University, excuse me, with us today to share some information on integrating financial capability and asset building strategies into human services. As I mentioned, this is one of my favorite topics, in being able to look at our service of delivery and to identify ways that we could incorporate financial education, financial coaching, free tax preparation services, and other asset building activities into our delivery of services. We're fortunate today to have two presenters who were authors of a new guidebook on integrating asset building within human services. We have Dr. Janet Boguslaw, who's the Associate Director and Research Scientist at the Institute on Assets and Social Policy at Brandeis University. And we have Dr. Margie Erickson Warfield, who's Senior Scientist and Lecturer and Director of the Nathan and Toby Starr Center on Intellectual and Developmental Disabilities at Brandeis Universities. We thank both of them for joining us and to share with us more information on their guidebook, but also their work on integrating asset building services into human services. So with that, I'm going to turn it over to Dr. Janet Boguslaw. Janet?
Yeah, it's great work in this guidebook, and we appreciate the opportunity to talk about it today with your members and others in the human services field. I want to start by thanking the Kresge Foundation for their support of this work. I want to start with a brief introduction about our institute and then talk about why we focus on asset building in human services to provide some context for the webinar today. And then Margie will then talk about the intersection of asset building and disability issues to set the stage for an examination of the guidebook. At the Institute for Assets and Social Policy, which we call IASP, we work to enable vulnerable populations to build resources and access opportunities to live securely and participate fully in all aspects of social and economic life. We work in partnership with key stakeholders like the Human Service Assembly, our partner in developing the guidebook, and with organizations like NDI to ensure that our research products and technical assistance best fit constituencies' needs. So I want to talk a little bit about assets and wealth building and how it connects to human services. Assets, or what many call wealth, are the foundation of resources that families use to invest in their own mobility and economic security. Human services respond to the challenges of asset poverty and economic inequality through education, programming, policy advocacy, and collaboration to address myriad asset-based issues that limit opportunities. For example, nearly half of all employers now use credit scores to screen job candidates, keeping many qualified workers from employment. 25% of families spend more than half their income on housing. Racial and ethnic wealth gaps have more than doubled since 1995. Median white families own 20 times more wealth than Black families and 18 times more than Latino families. Financial stress is associated with a range of negative health outcomes across the life course, from early childhood through old age. And nearly 1 in 3 Americans with disabilities lives in poverty, and more than half, 59%, are asset poor. They can't live above the poverty line for 3 months or more if their income or current resource stream were to stop. Rates of disability are increasing for a variety of reasons, but particularly due to population aging and increases in chronic health conditions among those aging populations. So asset building strategies are the policies, programs, and tools that enable individuals, families, and communities to save and invest in future opportunities. That's a mouthful. But an asset building focus helps families realize aspirations and achievement in the short and long term. And it passes the knowledge, resources, and capacities gained to future generations, providing them with head start assets in life. The problems that derive from asset poverty and inequality pose critical challenges for individuals and families. You all know that from the work you do. Yet we observe the ways in which access to assets in the form of financial wealth, human capital and capabilities, improved health, social networks and resources all improve family well-being, security, and stability. So we say that when assets are held, they can be leveraged for all sorts of opportunities. They provide confidence in the future, enabling people to take risks, make investments, and work towards future goals that are achievable. It's important to note here that the benefits are not just to individuals and families. Asset investments build strong and stable communities and ultimately contribute to a stronger and more stable economy. That's why integration ownership of asset building as a goal or framework serves the interest of a broad group of stakeholders in human services and beyond. Today, the human services sector is working proactively as a community anchor to reshape the goals, outcomes, and impacts of social service delivery. Providers and funders are creating more comprehensive and sustainable impacts in a number of ways, including creating and growing asset building networks to pool and strategically leverage the resources of government agencies, public and private institutions, the business sector, community organizations, and the individuals seeking engagement. It also includes designing complementary and comprehensive programs along a continuum to reflect what it actually takes to create economic security, stability, and upward mobility for individuals and families. It takes championing new policies that create systemic change and making a long-term commitment to realize sustainable impacts. And most importantly, striving for an inclusive economy by identifying and tackling specific barriers that contribute to the growing racial, ethnic, and cultural wealth gaps. Through an asset building framework, service providers aim to create new opportunities and access points for individuals and families to move beyond current needs to build long-term security, stability, and well-being. Integrating asset building, the focus of the guidebook, integrating it throughout the service continuum ensures that families over the long term achieve better futures for themselves and their children. So that's an overview of asset building and the context for doing this guidebook. And now I want to turn to Margie, who's going to talk a bit about how the disability issues align with this focus on asset building.
Okay, thank you, Janet. As many of you know, there are particular challenges to building assets and wealth among individuals with disabilities and their families. I want to focus on two that are critical, employment and caregiving, which, if they're well understood, can be addressed and improved throughout the human services network. Many of you are aware of this already, but just to set the context, I want to review a bit of the data. We know there is less employment among individuals with disabilities, even among those willing and able to work. Various well-recognized population-based data sources confirm wide differences between the employment rate of the general adult population and that of adults with disabilities. The smallest gap in employment rates between those with and without disabilities is 38%, and the largest is a 60% difference. Even among those with disabilities who are employed, few are working full-time or nearly full-time, few are acquiring company-paid benefits or earning a living wage. The disparities in employment rates widen when only individuals with intellectual and developmental disabilities are considered. Only about 1 in 7, or 15%, of adults with IDD was employed in the community based on data from the 2012 National Core Indicators Project. Further, the National Longitudinal Transition Study showed that only 26% of youth and young adults with disabilities were employed 2 years after leaving high school. These differences in employment rates stem from a fragmented service system where employment services for individuals with disabilities are offered through different systems with different eligibility criteria. As you know, the definition of disability is focused on different things depending on the system. In the vocational rehabilitation system, the definition of disability is focused around limitations in major life activities. In the developmental disability system, it's focused around intellectual functioning. and in the school system around educational needs. One of the challenges for employment and asset building is that those who are unemployed or underemployed not only have low incomes, they also fail to reap the rewards of all the asset building benefits that come from steady employment. Things like retirement plans with a match, or flexible spending accounts, tuition and education benefits, paid sick days, or family leave. All of these, in addition to income, help to build assets and economic security. The second key issue is that families of individuals with disabilities are less able to build assets and wealth over time, due in part to caregiving responsibilities and out-of-pocket costs. Individuals with disabilities have less access to generational wealth and assets. Research studies utilizing various large public data sets have found that employees who live with a child with disabilities are 48% more likely to have lost wages. Out-of-pocket expenditures, particularly those for medical costs, are higher among families with children with a special health care need. Having a child with a disability increases the likelihood of mothers, and less often fathers, of reducing work hours or stop working altogether. Households with an adult with disabilities had substantially reduced net worth and income compared to households without adults with disabilities, regardless of family structure. So, individuals with disabilities and their families are more likely to live in poverty, in fact, more than twice the poverty rate of individuals without disabilities, and be low income. About 59% of individuals with disabilities are asset poor. As the guidebook suggests, asset building strategies for individuals with disabilities can be approached in two ways. First, disability-related service providers should be mindful of ways their clients and families can utilize existing mechanisms to build wealth. Second, service providers in other service systems that intersect with the disability community, such as community health centers, schools, and homeless shelters, should also be thinking beyond their immediate health, education, and housing concerns toward asset development for the individuals and families they serve. So that ends my section. I'm going to now turn it back to Janet, who's going to provide an overview of the guidebook. And then I'll come back on later to finish up with some examples of how to enhance asset building for individuals with disabilities and their families.
Great. So now I'm going to introduce you to the guidebook. And it's a little bit detailed, but this guidebook is available to you online. So it's a guidebook that the Institute on Assets and Social Policy and NHSA recently released. I'm going to start by walking you through the basics of how the guide is structured and how it can be used, and then I'll focus in on some of the content focused on the needs of persons with disabilities. So the guidebook is a primer on integrating asset building into human services. It allows readers to explore various asset development approaches, from tried and tested models to cutting-edge demonstration projects. Readers can also learn about innovative ways that human service providers are incorporating asset building opportunities into their service structures. The guidebook also allows readers to identify practical strategies for integrating assets into human services work, including how to build partnerships, plan long-term programs, and where to seek funding to support the work or to access technical assistance in moving your efforts forward. So you can download the guidebook from our website by going to iasp.brandeis.edu/resources. And on the left side, you'll see and can click on Empowering Prosperity Guidebook. There's a link there. And so the guidebook is structured for flexible use. It's separated into 3 chapters or parts. Part 1 focuses on asset integration and includes examples from several human services fields that have successfully incorporated asset services into their work. Part 2 focuses on assessing the asset building needs of specific populations and tailoring services to best address those needs. And Part 3 looks closely at interagency partnerships and collaborations as a strategy to address clients' complex needs around asset building alongside other concerns. So on our website, you can access the whole guidebook, or you can select sections that most closely apply to your work or that you want to examine in particular detail. So you can look at how assets can be tailored for various populations you can see in the list here and just print out just that section. So as I go through the guidebook with you, I want you to think about these questions. 1, how might you learn about the strategies others are using to build wealth and assets for their target populations? 2, how might they learn about yours? That is, where's the intersection of interests? And 3, who and how might you collaborate or partner with to do this integrated work? So here's a cover page for Part 2. From here, I can browse through the various populations represented in this chapter, listed across the top. Things like early childhood education, disability service providers, services for sexual and domestic violence survivors, senior services, and financial services for immigrants. And as you continue to flip through the guide, you'll find real examples from service providers within each of these service areas. And you'll find resources for building your own asset building program and lessons from the field. So I'm taking you back here to the table of contents. Another way to approach the guidebook is to focus on your specific area of expertise. Let's say you're a service provider that primarily provides and serves individuals with disabilities. So you can click on that specific section under Part 2. This will take you to a landing page for agencies that mainly serve persons with disabilities. So each subsection starts with some quick facts on the particular needs of this population and asset building strategies that can be useful. Once again, as you continue to page through the guide, you'll find specific examples from practitioners in the field, resources for practical use, and more. As an example of a section, I now want to dig into the section of the guidebook that focuses on asset building for persons with disabilities, just as an example. These pages can be used to spark discussion about lifting up the asset building opportunities in the context of service delivery. They can also be used to engage other partners or collaborators in the work you want to expand, helping teach and enter into discussions about this work across sectors. The sections can be printed out, as I said, as standalone PDFs. In this section, the guidebook discusses some specific economic challenges faced by individuals with disabilities and their families, and features many asset building strategies that can be employed to increase families' economic stability. So the guidebook, by section, introduces some key policies or strategies. So for example, in this section, it highlights individual development accounts, or IDAs, which are special savings accounts where individuals' deposits are matched by a sponsoring agency. So for example, if I deposit $5 into my IDA, the sponsor will also deposit $5. The money saved in an IDA must be used for specific asset building purposes, including higher education, home ownership, small business development, and adaptive technology. The guidebook provides one IDA program profiles one IDA program targeted to individuals with disabilities run through the Community Vision of Portland, Oregon. And it demonstrates how this woman, Laura, with developmental disabilities was able to purchase a home valued at above $140,000. So another asset building strategy highlighted that can be particularly useful for individuals with disabilities and their families is family financial planning to manage ongoing medical expenses and to address long-term financial costs for a child who's going to age out of care, to learn how to save for retirement while also planning for the long-term care of a loved one and for the care and advancement of other children in the family. The guidebook describes the work of the Parent Advocacy Coalition for Education Rights, which created a financial resource guide for parents of children with disabilities to help them anticipate and plan for both the short and long-term expenses. So these are just a few of the types of ideas and examples of what's in the book. A third asset building strategy that could be important for agencies that serve people with disabilities is the community collaboration model. Most states have active asset-building coalitions, which might not be aware of the distinct economic challenges faced by individuals with disabilities. Likewise, many agencies serving people with disabilities may not know about the asset-building programs at their disposal. Interagency connections, including the cross-training of staff, can be a valuable way to raise awareness across agencies in the community. In the guidebook, we feature NDI's Real Economic Impact Network, which educates asset-building agencies and others about the needs of individuals with disabilities and provides resources to make economic services more accessible. You all know about that, but others may not know about it. And so the guidebook is a way to raise awareness, a view about what others are doing, and for others about what the disability community is focused on and needs in terms of asset building. So in all, the guide features profiles of 25 human service providers from across the nation. I'll close with some major lessons from the guidebook. The first major lesson is that agencies that work across sectors and organizations to advance asset building can build a prosperity grid. A grid that is a term that we borrow from our partners at the National Assembly. It's a network of institutions that make prosperity possible for all families and communities. And this involves realistically assessing the barriers faced by different segments of one's community and then proactively building the connections across agencies and service areas to begin to meet people's comprehensive needs. The second big lesson from the guidebook is that providers across all areas must break down the silos in order to comprehensively address the barriers their clients face and move towards long-term solutions. The third major lesson from the guidebook is that asset building is a strategy connected to specific tools and methods that can enable agencies to address structural barriers shaped by race, ethnicity, disability, and other identities. Finally, it's essential to acknowledge that integrating asset work is complex and highly individualized. ISP staff, and Margie as part of our staff, are available to help guide you along this path either directly or by referring you to great resources for support. Please feel free to contact us at any time. Becca Loya, who's another author on this guidebook, wasn't able to be on the webinar today, but she is also available to all of you. So I'm going to turn it back over to Margie now, and she will talk about some more specific examples.
Okay, great. Here we go. Okay, I think I'm back on. Okay, thank you, Janet. So I'm going to go through the last final set of slides and briefly describe examples of how the asset integration strategies described in the guidebook could be of benefit for individuals with disabilities and their families. The first example focuses on certified employment support professionals working with individuals with disabilities to find employment. These professionals should be aware of the WIOA legislation passed in 2014 and begun to be implemented last summer. The Workforce Innovations and Opportunities Act provides additional funds to support the transition from school to employment for youth with disabilities. In addition, with some training, employment professionals could further support youth with disabilities in setting up ABLE accounts to be able to build savings while maintaining their eligibility for other means-tested programs, such as SSI. The second example focuses on community health centers that provide critical primary health care to low-income communities. Community health centers employ patient navigators whose function it is to provide care coordination services for all patients. For youth with disabilities who need support in transitioning from pediatric to adult health care, patient navigators could be trained to use the transition period to inform parents of the need to establish guardianship and to look into special needs trusts to protect assets and maintain eligibility for SSI or Medicaid. A final example looks at potential connections between homeless shelters or low-income housing complexes, and local early childhood services. Young children growing up in poverty have higher rates of developmental delays, as well as some chronic health conditions. Providers of shelters or low-income housing can support families of young children by connecting them to early intervention services, early Head Start, and Head Start programs. Not only will children get appropriate developmental services, these providers can connect families to tax assistance services. Now, these are just a few examples. There are many other possibilities for human service agencies to help individuals with disabilities and their families build assets, and the guidebook provides a good basis for providers to learn how to do this. So, Michael, I'm now going to turn it back over to you.
Great. Thank you so much, Margie, and thank you, Janet, for providing this information to us. We wanted to make sure to save a lot of time for questions, and we do have a lot of questions to get through. But before we do that, I would like to share with you a couple items on why we believe at the National Disability Institute integrating financial capability and asset building services into our service of delivery is important. So we know that this is important based on research as well. We know that by integrating services that it leads to better employment outcomes for individuals. It also leads to greater educational attainment, and it also enhances one's quality of life. At the National Disability Institute, we are working to help create this paradigm shift. And that paradigm shift is that employment is one goal, but not the only goal. The ultimate goal that we are working towards, we are all working towards, is to see that an individual achieves economic self-sufficiency. We believe that by integrating these services and creating a one-stop shop where individuals can access these wraparound services leads to greater success for individuals. So many of the questions that have come in have been, how do we do this? When we might have limited staff, or when is it appropriate for us to integrate certain strategies? And we're going to get into those answers further in the Q&A section of this webinar. I would also like to share with you that at the National Disability Institute, our commitment to integrating services within disability service organizations is there, and thanks to our support with Bank of America and their commitment to integrated services as well. We have several best practices from across the country of organizations who have integrated financial capability strategies into their service or delivery of services. Later this year, actually it will be in the summer, there will be a new brief that is put out by the National Disability Institute on integrating services within the disability organizations, where we bring together these best practices to be able to share and highlight those with our audience. We are still conducting interviews. After you've heard today's webinar presentation, we are still conducting interviews for this brief. So if you are an organization who has not reached out to us or we have not been working with in the past on integrated services, and you have a great best practice, then please feel free to reach out to me, and we will put my email address in the chat box so that you will have that. The other piece that we wanted to be sure to share with you that as you are listening to this information and you are interested in integrating services, one of the pieces that we provide technical assistance on here at the National Disability Institute is to help organizations and provide technical assistance on this topic. If you have specific questions on how you can approach this after you read the guidebook or you need additional resources, in addition to reaching out to our friends at Brandeis University, you can also reach out to us at the National Disability Institute by sending an email to ask@ndi-inc.org. and by sending an email to that email address, then you will be connected with a staff member at the National Disability Institute who will be able to provide guidance for you. The great thing is that National Disability Institute's Training and Technical Assistance team has grown, and we have several subject matter experts on this topic on our team to be able to provide that support, as well as one of the cool things about the team is that the majority of us are all practitioners. So we've come from the field, have integrated services, and now are providing technical assistance. So with that, what I want to do is to get into some of the questions that have come through, and these questions are going to lead to further explaining why this is important. So we have several questions here, so for the next 15 minutes, we're going to try to get through as many as we can. So the first question is to Janet or Margie. What have you found are the challenges to trying to do asset integration or integrating financial capability and asset building strategies into systems of delivery of services? Janet or Margie, which one would like to address that first?
Hi, this is Janet. Can you hear me?
Yes, great.
Okay, great. So thanks for that question. I think that's probably the first thing that jumps to everybody's mind because everybody feels sort of overwhelmed in their jobs and how can we do more? And what we've found are a few things in terms of the challenges. We found that for staff, they feel that this might be an add-on to the work that they're already doing. And when you use some of these materials to give people ideas about what it is that you're talking about, it doesn't seem as scary and as big, something to integrate into the work that people are doing. A lot of times everyone is in a, not quite a crisis mode, but dealing with the present and immediate issues that are facing families or individuals. And the asset building work really helps people plan for the future, envision the future, and put things in place for the future. So we're not saying don't do the things for the present. We're saying that you can build in these things that really give people a sense of a stake and a vision of the future that can lead to some stability. So how do you do that in a way that doesn't overburden staff? One of the ways is to use some of these materials here, and we've tried to set it up so there's things that you can print out in little pieces. You don't have to give somebody a whole big fat guidebook that kind of is overwhelming, and use staff to start having conversations. What we've seen is people slowly starting to build in services. So an organization that might be focused on assisting persons with disabilities might connect with a free tax prep VITA site in the area and have those individuals come to help do free tax prep at a location that's maybe more accessible or easier. And they might not realize that there's a whole group of people who don't have access to a facility or a network. So sometimes it has started very slowly at tax prep time as one way of doing that work. During tax prep time, it's a nice time for staff to ask people questions about their financial concerns, both present and in the future, and that's a way to start bringing in some financial education that is more targeted. So again, you don't have to become the financial education experts, but in the communities, especially in most states, there's an asset building statewide network. They can plug you into resources, often free, where people will come and do different programs because it will dovetail with the programs that are being offered in the community, but maybe not for this targeted for the particular needs of a particular population. So we've seen it slowly happen, and then we've seen some multi-service organizations just completely embrace wanting to do this work and write grants together to get funding to ramp it up and to integrate it across all of their organizations. So I'm not sure if that answers the question, but people can send in some follow-ups.
Great, excellent. All right, the next question is, are there specific financial capability strategies that have more of an impact on an individual's financial lives? And I believe this question is pertaining around if we're looking to start integrating services, is there a key piece that we should start with? So through the guidebook, through your research, have you found, are there specific strategies that have more of an impact on an individual's financial lives? Margie or Janet?
Margie, do you want to go or you want me to?
Sorry, I'm trying.
I think her mic, I think, is going in and out, so maybe I'll start and she can jump in. I think the question is the who. So many people don't have savings opportunities, and there's so many ways that people can plug into savings, but they don't know about it. So, for example, in public housing, people are eligible for family self-sufficiency programs, and a lot of people don't know about that. So if and as their income goes up, the delta, the extra money that they would make, instead of it going to pay for their rent, it can go into a savings account, and they can do this for 5 years, and then they can draw on that money for assistive technologies, for a car, for education, or for a down payment, you know, the first and last month's rent on an apartment if they want to move out. So that opportunities where people have a chance to get ahead a little bit and not be always eroding their resources as they start getting ahead, maintaining their eligibility and letting them build some resources is one of the most important things. And what we find in the research is that so many people are living day to day or week to week, and when they start to be able to build a small nest egg, even though that can seem contradictory because people have needs right now, building that nest egg gives them a sense of security and thinking about other ways that they can build their resources and really be able to access them. So the FSS is a really good model. The ABLE Act now allows people to build savings. The same with the FSS, that it's not means tested, so that you can build a savings account and get a nest egg, and it doesn't count against the benefits that you might be receiving. And a number of people have been using the savings opportunities through IDAs, these individual development accounts, because for every dollar, sometimes it's matched 1-to-1, sometimes it's matched 1-to-3, and it's a way that people can participate in financial education, but really build a savings program. So I would say that to a certain extent, that's one of the most important ones. We also know that for families where anybody in the family has a disability, that, every part of the family needs to be planning for the future. So, there's maybe other kids in the household, and there's the parents who are going to retire, and everybody's living longer. And so having that financial planning component or available to people, and a lot of people are doing that in partnership with organizations that provide more professional financial counseling that usually is what is accessed by higher income individuals. They go to a financial planner, but sometimes those organizations are willing to provide pro bono services to different organizations to help their clientele move forward.
So this is Margie. Can you hear me now?
Yeah.
Oh, good. I would just add a little bit onto what Janet said both now and to the previous question about, good times to think about expanding the kinds of services you provide. So we've done some look at the period of transition from adolescence into adulthood, and here, you have a major shift from, the educational service system into the adult service system, and both of those systems are quite different in terms of who is eligible for what and what you can get access to. And so it may be a good time for providers to take a step back and kind of look holistically at all of the kinds of needs and abilities that an individual has and where the family's at, and include, asset assessment at that point in time, so that, is this a good time to open up a new account where you can save some additional funds? Is this a good time to look into, possibly getting more education through some of the newer educational programs that are being developed through higher ed for young people with disabilities? And so just kind of doing an overall assessment of what are all the services that are needed and where are the places that wealth building or asset development can be incorporated. I think at any time of transition, it's a good time to begin to ask those questions.
Great, thank you. And I would like to add to this question as well. One of the things that we look at about specific strategies that have more impact, we encourage organizations and individuals to look at the public benefits that they are receiving and to make sure that they fully understand the work supports that are attached to them to help them achieve self-sufficiency. So it's very important that an individual meet with a benefits planner or community work incentive coordinator, to share with them what their financial goals are, but also to be able to identify the particular benefits they're receiving and what are those supports attached to those benefits to be able to help them then also save money and build their financial lives. So thank you all for that question. So the next question, and then we have a lot of questions, so we may have to do a speed round here. But a question that came in is, how do we motivate our staff to add in integrated services or to add in additional activities to their work? Janet, would you like to take that?
Well, I have to say that I have been amazed by how much staff like working on asset building initiatives. I think that it helps the staff feel really positive as well, because they know that they are really helping people for the future. Most of what people learn about asset building helps anyone in their own individual lives. So staff often feel that this is training. What we remind people all the time is that, you're not becoming a financial counselor. You're not becoming the expert. You're identifying, what the needs are, and then sort of that's what sort of this theme of partnership and collaboration is about, finding the resources in the community and trying to make sure that those resources are brought in or linked to. But typically, when you think about the network or the range of things that we talked about earlier that we consider asset building, a lot of those are not the things that traditionally in service provision people have been focusing on. So we've done a lot of work with staff, and I would say that this is something that becomes integrated as part of a core set of questions that people ask. There can be brochures or posters up in a workplace or an agency that ask people certain questions and, prompt them to say, ask about this, ask about that. And so part of it isn't that it's adding to the workload. It's simply expanding the range of opportunities that are available to people. And, some of it is, I don't know how many of those people who are listening right now and are on this webinar specifically work with agencies that are only targeted for persons with disabilities. But what we also want is for the information to get out to the other organizations and staffs at places where things may not be on their radar. So, for example, we want people to know about some of the caregiver policies that are taking place now where, if you're doing caretaking for someone at home, then you may be able to get a weekly stipend for caring for someone. And so we want, and that could be for caring for children, or it could be for an aging parent or somebody who's recently become disabled. And so what we want to do is get the information out and have the people who know about this get it into these other networks so that they're aware of it and can help families who may not be coming only to the direct service providers who are doing disability services to understand what would help those families as well. And so we haven't found the kind of resistance that you would think, because mostly people feel like it's pretty empowering and exciting, and their clients get excited about the opportunities.
Great, thank you. So the next question is, many folks with disabilities are not able to access IDAs, especially if on disability and live alone. Can you address this limitation?
It's probably a broader question than what I can answer it's probably a broader answer than what I can address. And Michael, you might be able to help me with this. The availability of IDAs, it varies by community, whether communities are offering that. There's state IDAs that are in place as well as national IDA programs. So some of the challenges, again, making sure that if there's an opportunity to establish some of these programs in a community, that they get established, because some of it is simply an issue of access. And Michael, I don't know if you want to add to that.
Yeah, I think that's a great point that you make, depending on if the IDA, there's an IDA provider available within their geographic location. The other thing is about an individual development account is that it is a program to help individuals build assets, one of three items, to buy a home, to continue their education, or to start a business. It is a work program as well, in the sense that I have to have wages to be able to contribute to my individual development account. So that is an important piece, to keep in mind as well. So an individual would need to have, if that's $25 they put into their IDA, the IDA, that money does need to come from wages or to be able to put in there. But the person who asked that question, if you send us an email, we have some great resources and tools that we can send you, as well as on our website, we have a tool called the Top 12 Financial Wellness Links of 2016 that my colleagues and I here at the National Disability Institute put together. And you are going to find a link to, that's one of the top 12 links that will take you to tons of information that you can, to provide you additional information on individual development accounts, accessing them by persons with disabilities, and other tools. And you can go to www.realeconomicimpact.org, and in the search box, type in the top 12 financial wellness links, and you're going to find that. Okay, so we're going to get in a couple more questions here. So the next question that came in is, what resources are available for projecting future financial needs of a disabled adult child? Margie, would you like to take that question? I know you touched on it a little bit earlier about transition, but is that a question that you would like to provide thoughts on?
Generally, I think, there's been some research, I think most recently, around sort of the projected costs related to providing for the needs of individuals with autism spectrum disorder over the life course. So there are some people who have tried to pull together a variety of pieces of data to sort of project what both the kind of societal level costs are as well as individual costs. I think one of the challenges in doing any cost analysis is that it's very individualized in terms of what the person's needs are and how they can best be met. and the fact that there is often some uncertainty about the course of development over time. You know, I was part of a longitudinal study for many years where we tried to look at the developmental trajectories of early on of young children with disabilities over the course of their lifetime between infancy and young adulthood. And there's a great variability in the developmental patterns of individuals over time, which would then also relate to the kinds of services and supports that they need and the best way that families can provide those. I think Janet touched on this a little bit in one of her comments, and is that, you know, I think there's a lot of discussion around, you know, what is the appropriate role of families in providing care for individuals with disabilities, and where does that role begin and end, and where does, you know, community services and governmental support services need to come in? What is the responsibility of families vis-a-vis other resources for supporting individuals with disabilities? And there's a lot of creative work being done in many states through a lot of waiver programs that are looking at, you know, how can you enable a caregiver to be paid to provide some of those supports. So that's a support not only for the family in terms of being a wage earner, but also providing, you know, intimate care to an individual with disabilities. And so there are many state-level programs across the country in a variety of states that are both looking at and have implemented a variety of creative programs to look at better ways to provide care for those who need it, to enable them to stay in their homes, to be integrated into the community, and those sorts of things. So I think the exact costs are hard to estimate, but there's a lot of creative work out there in developing new ways to approach service delivery.
Great. Thank you so much. Well, we're coming up to the end of our time. We did not get through all of the questions, but we will put some responses together to the additional questions and then make sure that those are available on our website as well. The slides will be available. A recording of this webinar will also be available on our website, as well as the transcript of this webinar will be on our website as well. If you're not a part of the Real Economic Impact Network, I hope that you will join us and be a part of this conversation. And you can learn more about the Real Economic Impact Network on our website at www.realeconomicimpact.org. And if you have specific questions on strategies to build the financial wellness of persons with disabilities, you can send your questions to ask@ndi.org. I hope that you will join us on March 22nd as we are excited of a new cooperative agreement between the National Disability Institute and America Saves, as we work together over the next 3 years to increase savings opportunities for individuals with disabilities. We will be working together to do that. And so on March 22nd, we will be announcing this new collaboration to promote savings opportunities for Americans with disabilities, and it will be put on by the National Disability Institute and America Saves, so we hope you will join us for that. Also, at the National Disability Institute, as I mentioned, that integrated services is a key piece for us. And so in April, you'll be learning more about a new community of practice called the Financial Integration Team. And this is bringing 10 organizations from across the country together to create a peer-to-peer learning network on integrated services for individuals with disabilities. And so be on the lookout for that information, where we will be sharing the best practices, analyzing the best practices, and looking at the various models even further, and creating this peer-to-peer network with that. And we will be using the guidebook. So we're very grateful to Brandeis University and to the Institute on Assets and Social Policy for including us in the guidebook, but sharing this information with us today. So I would like to thank Dr. Janice Boguslaw, as well as Dr. Margie Erickson-Warfield at Brandeis University for putting this great book together and for providing this information to our audience today. I'd also like to thank my colleague Ashley Bray for her assistance, Nakia Matthews, and the entire training and technical assistance team at the National Disability Institute who helped put all of this together. Finally, we would like to thank Bank of America, again, for their support of our webinar series and for their support in building the awareness of integrated services for disability organizations. So again, thank you so much for spending your afternoon with us, and we hope that you have a great day. Thank you. All right, Janet and Margie, thank you both so much. We're good.
Thank you so much, Michael, for the opportunity. Bye-bye.
Right. Bye.
Thanks a lot. Bye-bye.